I want to get started with Alba, because Alba, she goes by the Veg Nurse, which means she's a nurse and she's also vegan, and she's on the front lines right now with this coronavirus epidemic, COVID-19. What has been your experience working in the hospital, taking care of these patients?
Well, I want to make a correction, Sean, and the rest of the listeners and our viewers. Right now, yes, I am a nurse. Everybody knows that. The thing is that I am not right now currently, at least Florida, is not in the curve of where we are compared to New York or where Washington was a couple of weeks ago. So technically, I am not at the forefront just yet. Currently, right now, at least my hospital and other hospital systems around South Florida are still waiting for that curve where we're going to be getting the influx of patients that are sick. We're unfortunately going to get the influx of people who are dying, like for what New York is going through right now. So I do come from an ER background. I have gone to the ER to keep my skills up because I did technically leave the emergency room about 2.5 years ago when I went into the cath lab. But, you know, I get bored easily, so I usually like to go downstairs. So right now I'm kind of like switching back and forth between cath lab and ER. To answer your question, currently, I don't know about any other hospital system, but at least my hospital, and for privacy reasons, I'm not going to say which hospital system I work, just be aware that it is in the South Florida area. Like most other hospitals, elective surgery has completely been stopped. Unless it's an emergency, unless literally you have something that has ruptured or you're actively bleeding or you are actively getting cancer treatment, then yes, we are coming in and doing that. When it comes to the other hospital workers that are finding themselves, because there's many of them who are finding themselves going home early, they're sending them early to save on equipment, save on time. Many of them are helping in the ICU, for example. If you come from an ICU background before coming into the surgery, OR, or cath lab, so they're more what we call the forefront, because we do have confirmed cases of the COVID-19 who are on ventilators, who are on certain medications, and they're still utilizing those skills of ICU critical care instead of being in the OR.
So right now, you mentioned it's not as heavily, we're not getting the rush right now that a lot of other places are getting. If someone's listening to this right now and they're not quite sure on what to do if they do start getting sick, what advice would you have? And this is for anyone right now, because I'm sure there's a lot of information out there that we all have consumed.
Right now, what we are telling everybody, and thank God that Governor DeSantis said stay home, pretty much stay home. And if you are going to go out or anything like that, then do it very limitless, and stay obviously the distance, because the reason why, and a lot of people don't understand, why do I have to stay 6 feet? Well, the reason is this virus, this sickness, this illness, it is droplet precaution. So that means that when people sneeze or cough, little droplets, and they tend to travel up to 6 feet or so. So if you're breathing that in, it can go straight into the breathing mechanism of the body or anything like that. That's the reason why we're saying stay 6 feet away. That's what we're saying, cover your mouth. And it's not only to prevent other people getting sick, but that's just rude. You don't want to get splashed. That's nasty.
Agreed.
Yeah, you don't want to get splashed, no. So, and another thing that if you do follow me on social media, you'd have seen that I did a rant not too long ago about people wearing gloves outside and touching everything. Think of it like this. As a nurse, even let's say, Sean, you're there for surgery, I'm changing just on you. I'm changing my gloves between 3 to 4 times just on you. I don't use one set of gloves for one patient. Because if I'm touching your groin, if I'm touching your foot and you're sweaty, for example, then I'm touching the computer, then I'm touching the equipment. So a lot of these people that are going to the grocery stores or other essential places, they're wearing the same gloves for everything. And I've seen them touching their mouth with their saliva. I've seen them pick their nose and then pick up produce and put it back. Yeah. And then I've also seen them touching their phones. And we all know that people read in the bathroom with their phones. So if you look at studies, and everybody knows this, you're going to find fecal material or other nasties on your phone. So if you're touching that with these gloves, you're actually spreading it. So please, I am begging you, don't wear gloves. And if you are going to wear gloves, please make sure you're bringing 3 to 4. So if you're actively touching your mouth or picking your nose, ooh, you know what? Let me change them and touch. No. Beyond that, don't wear gloves. Number one, it's rude, I think. And I could be right now like hit over the head for this, because some people think that, oh, okay, well, I'm wearing my gloves, I'm protecting myself. Actually, no, you're not, because a lot of these people are also not changing their gloves or taking them off when they get in their cars. So they're driving with gloves.
Wow. I'm glad you said that, because it was always in the back of my head with the glove situation. It's like, okay, I think I get why you're supposed to wear it, but at the same time, it's like, I'm only wearing one pair. I'm careful not to touch my face, but at the same time, it's like, it's not disappearing once it magically touches my glove. So like no. I'm glad you mentioned that. So let me ask you this question. One of the big things I'm coming up against is, yes, we're supposed to be sanitized, obviously washing your hands the proper way. And I'm going to ask you, Jackie, I've seen a couple of videos and things of you about hand washing. I want you to talk about some good techniques. But I can't find cleaning supplies. I can't find like things in the supermarket. So like, what am I supposed to do when I don't have a basin to wash my hands?
Right now, okay, so the crazy started, about a month ago, when everybody started buying the paper toilet, the paper towels, and they started taking all the sanitizer. That was, I think, based on fear, and I blame the media a lot for that. The media does give us good information, but sometimes they have a way, because they're trying to increase ratings and sensationalism. So they're like, oh, this virus, we need this, we need that. So people follow that and they go half crazy. Listen, guys, whoever's listening to us and watching us, paper towel and paper toilet is not going to save you from the virus. Let me just tell you that right now. Unless you're Jackie, you're a big fan of fiber. Unless you're going to be eating multiple fibers and pooping 5, 6, 7 times. That's probably the only time that you're going to need toilet paper. Okay, let's be real.
Unless you have a bidet like my bathroom has, you guys, and we don't even need toilet paper. How about them apples?
Correct. So that's not going to do anything. I've seen that it has gotten better. Even when I go to the store now, there is toilet paper, which I found. Pretty much bring your own little sanitizer if you're able to get it. You should be able to get it on some stores now, which is actually good, because the hype kind of quote has kind of gone down. But call ahead. I've learned that kind of helps a little bit, to call ahead the stores, like, hey, do you have hand sanitizer? Hey, do you have something or other? And even if it's a small little bottle, you can get that. And I think, and pretty much washing your hands as much as you can. But that's the whole purpose of staying home. Don't give yourself that opportunity that you need to wash your hands.
And I do think a lot of stores are now limiting the quantity that you can get of these things. So I think that hand sanitizers and toilet paper and these different necessities, they're being stocked a little bit better in most stores and locations. But I like your suggestion of calling ahead, being the first one there when it first opens, when it's your age range of time to go shopping.
And only go out as necessary, due to the fact that, some people don't realize that they're spreading it, because, again, like I mentioned, they're touching certain orifice in the body, and they might be carriers. They're not aware. And you don't want to be caught in that type of situation. And if you have to say something, speak up. I found myself doing that when I was at Publix. There were glove-wearing people. They were touching the credit card machine, and I had my wipes. And I said, excuse me, can I just wipe this down? The cashier said, no, we'll do it for you. Just request it from us anytime you come. And I was like, okay. It doesn't hurt to ask, especially in a situation like this. I've also, not to be rude, but I even told one lady one time, ma'am, if you're going to cough, at least cover your mouth, because I'm like right next to you. Please. Mm-hmm.
This is when it's important that we do speak up, because this is our health that we're talking about. And I think it's good that you were vocal at that point. And Marcia, like, she's been shopping in the grocery store and people aren't 6 feet away. This is before the grocery stores have tape on the floor. And she was like, back up. Back up. Back ass.
Well, I don't think anybody would say anything to a 5'9" blonde, like, I'm scared of her. If she told me, back off, I'd be like, yes, ma'am, right now.
One of the things that I actually did that I would recommend other people doing, like to whatever your local supermarket is, because we're no product placement here, so I won't name any, but whoever your local supermarket is, I went to a stock clerk and I asked them, when's the best time to come in for fresh supplies? And they told me 10 o'clock for that particular store. It's probably not the same everywhere. So finding that out is also probably a good way, so you're not just wasting your time, putting yourself at risk, going to the supermarket for to not get those supplies that you still need or haven't been able to purchase. So that's something else you might want to try.
Right.
Okay. So so how have both of you been staying healthy during this time? Because I know it's very tempting, probably not for you two, but very tempting for certain people to not necessarily follow the best regimen in terms of the types of foods you eat. So what are you two specifically been doing?
I can go ahead and go first. So you guys, I'm going to talk about a couple different things. So in terms of staying healthy, the best things, like Alba said, I want to reiterate what she's saying. Stay home. Hashtag stay the F home. And if we're not going out, then we can't spread it to everyone else. We should also act like we have the virus so that we don't infect other people. Miami Beach now has an order where you have to wear a mask anytime you go outside. So now I am starting to wear a mask whenever I go outside. But just like Alba was talking about with the gloves, you don't want to touch the front of the mask. And if you do touch the front of the mask, you either need to take it off, replace it, or wash it. So you have to be really careful with the mask as well. So staying home, wearing a mask, only going out for essential items. I'm working out at home, you guys. Exercise is one of the best things that you can do for your gut microbiome. So I'm working out inside. Sometimes my husband and I will go outside, take the workout outside, but it's usually inside because we do workouts from YouTube. And let me tell you, this is a fun time for my husband and I to bond together because we're doing these workouts together, and it's a lot of fun. And then nutrition, obviously that's my jam. But nutrition, eating more plants. The American Gut Project, they talk about getting 30 unique plants in a week. Mm-hmm. People are like super excited about like the superfoods this and superfood that. But legit, the best thing you can do is eating 30, and a lot of my plant-based doctors, so now here at Plant Chicks, we recommend 40 different unique plants every week. So I'm bathing my gut microbiome, again, building up my immunity through my nutrition, my fitness, and then connecting is the other way. So I get up, I have a whole morning routine where I do some prayer, some meditation, reading. It's like an hour of this like chill, amazing time. And then at 8:30 in the morning, I get on a Zoom call with anywhere between 15 and 30 women. And if I miss a morning, I'm getting texted by all these women. It's so incredible. Alba and I just had a Zoom call this morning, our vegan breakfast with our plant-based people here, and it was so incredible. So Zoom has been amazing, or FaceTime, or whatever kind of video conferencing or video calls you can do, because it's so nice. Like here we're on a Skype call, so I feel like I'm with Sean and Alba, and it's so amazing, and it just is really good for connection. So health is so much more than just the food and the fitness and the fun. It's also right now staying home. So if you have loved ones in the area, like this is actually a time when I'm glad that my parents don't live here, because if they did, I would want to go and see them. But I would actually be showing them more love by not going to visit my elderly parents and staying home and just helping them from afar, maybe having food delivered to their house or something like that. But it's really, really crucial that we stay home, wash our hands, wear a mask if we go outside, exercise, eat a variety of plants. Whatever you do, eat more plants. Take out the processed junk food, the vegan junk food, eat more real whole plant foods, and connect with people. Get on calls, but audio or video calls, I mean. And those are my tips.
All right. And Alba?
Well, I don't know if I have tips that Jackie hasn't mentioned already, because pretty much is what I do anyways, but I do have to say this to my fellow, I guess, medical professionals, and it could be anywhere from the paramedic to even the people that clean the rooms. I also give them props for them, because they're the ones cleaning away the filth after we move that patient out or that patient has expired, unfortunately. But I do have to say this, on the days that I do go to the hospital, I make sure that I load up a lot on my wellness shots, which is cayenne pepper, ginger, a lot of those shots just to boost my immune system. And I have to mention this. A lot of my coworkers are like, well, she's vegan, so no virus is going to get her. Hey, you know what? Maybe I might have advantage over other people. I don't know, but just and I want to make sure that everybody understands this, does not mean that you are immune to any type of virus. I have gotten sick in the past. I have never had the flu. I can say that with all honesty. Never had the flu. I didn't even know what that was, but I do come from a different country. But I've never had the flu. I had very bad colds. I even had strep throat one time of a patient who did cough in my face. Hence the reason why I said, do not do that. Please be polite. Please be nice. Do not cough on people. And if you are, like I said, excuse me. But I did get sick super bad for over 2 weeks. My boyfriend, thank God, was very kind to me. I was on very heavy antibiotics, which I don't take anything. But I had to be on very heavy antibiotics, and that threw my flora. It was a very bad time for me. It was about a month of over recovery that I had to get back into it. So on the days that I'm off, it's just like Jackie said, still have my green juice in the morning, meditate, exercise, because the more you exercise, your immune system does get boosted up. So that's good for you. Drink lots of agua. And connect with your loved ones. My boyfriend right now, my boyfriend Jose is in Texas right now, working in the hospitals as well over there. So he's a paramedic. So for us, Zoom calls, FaceTime, or anything like that has helped a lot. It helps us to connect in a whole different way. And you might feel isolated. I know I was, because all of you guys know I love to go out. I love going out to dinner. I miss my friends. I love concerts, whatever. So anything that you can do probably outside. If you have a small balcony like I do, I just recently ordered some furniture from IKEA that I'm waiting on. So I'm going to wipe all the boxes down before they arrive here and set it up outside, so at least I can get some fresh air. Mm-hmm. Those are, I don't know if those are tips, but those are what I do to keep my sanity. Jackie will tell you, and again, if you do follow me on social media, you'll see me dancing around with my coworkers. We keep the 6 feet distance still, even between us, somewhat, as much as possible with our equipment on, and just dance around. Send some good endorphins down your body, down your system.
So we talked about some things, of ways that we are thriving during these times. But a lot of people, when they're searching on the internet, looking at all these different feeds, you can get bombarded with a lot of negativity, a lot of doom and gloom. So I want to shift the scales a little bit and talk about what are some of the positive things that you've seen come out of this situation that we're in. Let's stop talking a little bit about all of the negativity. What are some of the positive outcomes of this shift in our world?
What I've seen, at least in my experience, a lot of the influencer friends of ours, a lot of the people who are on the spotlight, they have gone together and they have made either a post or a story encouraging their followers to donate the protective equipment that we need. For example, let it you be in Ohio, or if you are in California or here in Florida, I got to give props to them. And like Will Brooks from Ohio, we did an interview with him. He was on one of my blog interviews, and he was like, he made a post and he was able to get some people to donate to their local hospital. So in a way, it's bringing that influence that you have, certain followers or your own celebrity, that you're trying to help as much as possible. I've seen in the news people are coming together to get meals for people who are in financial issues and financial troubles. And myself, again, shout out to Chef Ty. He cooked for me and he brought it to the hospital. They didn't allow him in, but he brought it. They brought it up. Security brought it up to my floor. So, thank you, Chef Ty. I loved your empanadas. They're really good. And care packages that people are giving to the hospital. Other businesses are knocking on our doors and be like, hey, can we give you guys lunch? Just as a thank you for what you guys are doing. So I've noticed a lot of gratitude for what we're doing, but a lot of gratitude that some people are still healthy, and one way or the other, people helping each other, which I love.
And I've noticed that it's almost like this universe needed a pause button. And this is exactly what we've gotten. We've gotten a pause button, and people are slowing down and they're reconnecting with what's important. We're not able to go out as much, so we're not so bombarded by things, and we can actually slow down and be present and really internalize and learn and grow. And I literally just got a text before we got on this call, and one of my girlfriends, she's like, I think I'm kind of digging this, because I'm part of so many different meditation groups right now, and so many people are really learning and growing and bonding, and just the connection can even say my husband and I are connecting on a deeper level than what we have in a long time. And this has just been the past 3 weeks. But there is a funny YouTube video. What's the redhead guy, the comedian? Carrot Top. Not Carrot Top. I can't remember his name. I'll have to find it.
He wears the headband?
Yes.
Okay, I don't know his name.
He does this funny video about like the quarantine and relationships as the husband and the wife, and I forwarded it to my husband, and he was dying laughing. He's like, I can totally see some similarities, because in the video, the wife is like, let's do something together, and the husband is like, dude, we're on a 24-hour date. How can we do anything more together? Yeah, I'm like, hey, what are you going to do now? And he's like, hey, get away. It's kind of funny. We're having a lot of fun. Though we also have, like, we have to give each other our own room in the house, which we're doing. And I have to say, I work from home, and it's been really nice because my husband has been he's been very respectful of my time. So during the day, during the week, he literally leaves me alone. And we work out together, we watch movies together. But I've just seen a lot of connections really strengthen. And I think I've actually really enjoyed this quarantine, to be honest.
And some people are actually doing improvements on their homes. It's like, oh, now I have time to
my brother-in-law and sister.
Now I have time.
My brother and sister-in-law.
Yeah.
Yes.
I know that I've been working on my little garden a little bit more because I don't have time. That's what, you know what, Jackie? Maybe that's the reason why I kill the plants, because I never have time for them.
Correct. Yes.
So I've been learning a little. So I've been learning a new skill, which anybody who's close to me knows that I can keep animals alive. Everybody knows I have my little baby over here, which happens to be Kona, the official dog of SoFlo Vegans. She's alive and happy and thriving, but with my plants, it's like, I'm learning a new skill of how to bring them.
And to that,
and that is one thing. I'm glad you brought up a new skill or new hobby. Like, take that time, take this time when we have a little bit more time available. Learn a hobby, learn a language, learn a new skill. This is that we never have this time. So now we finally have this time where we get to slow down and just be. So now's the time to do whatever it is on your bucket list that you wanted to get done that doesn't require travel or whatever. So I think this is actually it's coming at a much needed time where we really did need to just like pause and breathe and just be.
Mm-hmm.
And another thing too is, I don't know if you've seen like the reports or the articles, but a lot of the environment is starting to heal itself. A lot of the waterways are becoming clear. The ozone layer is starting to slowly repair itself. I think I look at it like the Earth put us in a timeout. You know, it was a fever. You know, it's all these signs have been showing itself where it's like now I can repair all the damage that's been done. And my hope is that we get to see that we were the direct cause of everything that's been happening, and we can come up with solutions on how to make this a sustainable way of living once the threat has dissipated. You know, that's my hope. And I feel like with a lot of the going back to the skills as well, people now have the time to go on YouTube, go to Corsica, go to these different places and learn the things they've always wanted to learn. Like, I'm a huge proponent for content creators, because a lot of people have a story they want to tell, something that they want to share. Now is the opportunity to learn those skills so you can use the medium that everyone's consuming right now to share that story. So I echo everything that both of you were saying, and I'm excited to see, you know, obviously I would love for us to get back to normal where we can actually be in the same room as each other. And if this is the new normal, you know, how do we thrive and continue to grow during this time?
Can we pause one moment, please? Like I said, I'm waiting for IKEA furniture, and I don't know if that's the truck, but if anything, I'm just gonna quietly put mute and let the guy in, and that'll be it. But I just wanted to share that. Okay.
No problem. So we're gonna, before I move on to the next thing, because we have a lot of exciting things going on with SoFlo Vegans, and I want us to get into it and share what we have brewing. But anything that we may have left off, because I do want this to be a service to people who want to be able to get all the information together in terms of, how to thrive during this time. Jackie?
There is one thing I want to say that we are doing with Plant Chicks. We are starting the 30-day challenge. It's going to be going on this month. It's a 30-day challenge, and it's all nutrition, fitness, it's connection, it's everything that we just talked about, ways to improve our gut microbiome, feel healthy, feel healthier, get healthier, feel better. And we want to roll this out. SoFlo Vegans has a link, so make sure you sign up for the 30-day challenge with the SoFlo Vegans link, and let's get through this together. We're going to hashtag Plant Chicks, PLANTCHICS, and this is going to be a time to really thrive and get connected during this quarantine.